Lung failure is the leading cause of death in patients with COVID-19. That's why ventilators have become a precious commodity in hospitals across the country. But a doctor at Methodist Hospital says nitric oxide may be the key to keeping coronavirus patients out of the ICU.
It improves blood flow, it improves oxygenation, and there's some evidence that it also can directly destroy the virus.
Dr. John Cook says the medication was used during the 2004 SARS outbreak. It's already being used to treat people with lung failure in intensive care units.
Well, it's already a treatment option in Houston at the Houston Methodist Hospital. We have been using it in selected patients with COVID-19.
Clinical trials are underway internationally. What's new is offering nitric oxide gas to people early on with mild to moderate cases of the coronavirus. The trials will show if the treatment stops the virus from devastating people's lungs. If it works, doctors hope nitric oxide gas will prevent COVID-19 patients from ever needing a ventilator, and that would free up some much-needed space in ICUs. Stephanie Whitfield, KHOU 11 News.